Hello, fellow cat lovers. Today we're discussing a serious topic that many cat parents face: how to properly care for and help an underweight cat. Whether you've adopted a skinny cat, noticed your cat losing weight, or are dealing with a cat that struggles to maintain a healthy weight, this comprehensive guide will help you understand and address the situation. Before we dive in, please remember to subscribe to our channel and activate notifications for more in-depth cat care guides. Let's begin by understanding what makes a cat underweight and why it matters. First, let's talk about what underweight actually means for a cat. Veterinarians use something called a body condition score, or BCS system, which runs from 1 to 9. A healthy cat typically scores between 4 and 5, while an underweight cat scores 3 or below. When you run your hands along an underweight cat's sides, you'll easily feel their ribs, and their spine and hip bones might be prominently visible. It's important to understand that different cat breeds have different ideal weights. A healthy Maine Coon might weigh 15 to 25 pounds, while a normal Siamese might only weigh 6 to 10 pounds. This is why we focus on body condition rather than just numbers on a scale. Being underweight isn't just about appearance. It can seriously impact your cat's health. When cats don't maintain adequate weight, they might experience weakened immune systems, poor wound healing, reduced muscle strength, vulnerability to infections, difficulty maintaining body temperature, fatigue and lethargy, and compromised organ function. Before we discuss treatment, we need to understand why your cat is underweight. There are several potential causes: medical conditions, hyperthyroidism, diabetes, dental problems, parasites, inflammatory bowel disease, and cancer can all cause weight loss. This is why a veterinary checkup is absolutely crucial as your first step. Some of these conditions are very treatable, but they need proper diagnosis. Behavioral issues. Some cats become underweight due to stress, anxiety, or competition with other pets for food. Environmental changes like moving to a new home or introducing a new pet can significantly impact eating habits. Age-related issues. Senior cats might struggle with weight maintenance due to reduced appetite, dental problems, or decreased ability to smell and taste food. Dietary issues. Sometimes the problem is as simple as not getting enough calories or the right type of nutrition for their specific needs. Now that we understand the fundamentals, let's discuss how to care for an underweight cat. Remember, this should always be done under veterinary supervision, especially if your cat is severely underweight. Step 1. Veterinary assessment. Your first step must be a thorough veterinary examination. Your vet will perform a physical examination, run blood tests to check for underlying conditions, check for parasites, assess dental health, and provide specific feeding recommendations. Step 2. Creating the right feeding environment. The way you present food can significantly impact your cat's eating habits. Create an optimal feeding environment by setting up a quiet, stress-free feeding area away from other pets, using shallow, wide bowls that don't irritate their whiskers, maintaining consistent feeding times, keeping food and water bowls clean, and placing food bowls away from litter boxes. Step 3. Choosing the right food. Working with your vet, you'll need to select appropriate food for weight gain. This might include high-quality kitten food, which is often recommended for underweight adults because it's calorie-dense and highly digestible. Another option is recovery or critical care formulas, specially designed for weight gain and available in both dry and wet forms. When selecting food, consider the protein content, which should be high, the fat content, which needs to be adequate for weight gain, digestibility, and palatability, meaning how appealing it is to your cat. Step 4. Feeding strategies. Implementing the right feeding strategy is crucial. Start with meal frequency. Offer small, frequent meals throughout the day rather than 1 or 2 large meals. This is especially important for cats with decreased appetites. Next, consider food temperature. Slightly warm food, to body temperature, can make it more appealing by enhancing its aroma. Food texture is another factor. Some cats prefer certain textures, so you might need to experiment with wet food, dry food, or a mixture of both. Lastly, supplements. Your vet might recommend specific supplements or appetite stimulants if necessary. Step 5. Monitoring progress. Keep track of your cat's progress by weighing them weekly at the same time of day, monitoring their energy levels, recording food intake, taking progress photos, and noting any changes in behavior. Special considerations. For elderly cats, they might need special accommodations like elevated food bowls or more easily digestible foods. For rescue cats, they might need time to adjust to regular feeding schedules and might benefit from more frequent, smaller meals initially. For cats with dental issues, soft food or kibble soaked in warm water might be necessary. Common mistakes to avoid. Don't force feed your cat. This can create food aversion. Don't change foods too quickly. Gradual transitions prevent digestive issues. Don't overfeed trying to speed up weight gain. Don't ignore other symptoms thinking they're just related to being underweight. And don't skip veterinary checkups. While every cat is different, most cats should show improvement within a few weeks of implementing a proper feeding plan. However, healthy weight gain should be gradual. About 1 to 2% of body weight per week is ideal. Remember, helping an underweight cat gain weight requires patience, consistency, and careful monitoring. The goal isn't just weight gain, it's achieving and maintaining optimal health for your feline friend. If you're caring for an underweight cat, please share your experience in the comments below. Your story might help others facing similar challenges. Thank you for watching, and remember, with proper care, patience, and veterinary guidance, most underweight cats can achieve and maintain a healthy weight. See you in our next video.